Understanding Sophia Vergara's battle with thyroid cancer and what can we learn from her journey. Hi, I'm Dr. Lori, naturopathic doctor with a focus on metabolic cancer care. Now, with a cancer diagnosis in the thyroid, the question is the best approach just to remove the thyroid altogether and to be put on thyroid medications for the rest of your life? Now, this is the approach that Sophia took, and I want to dive deeper in what else we can do to support her and to make sure that we are looking at the whole metabolic effect of how cancer even grew in the first place. Now, the reality is that most people die with thyroid cancer versus from the thyroid cancer itself. So how harmful is thyroid cancer and which steps should be taken to prevent and lower risk of this cancering process? So in case you're not aware of the symptoms of thyroid cancer, early stages include hoarseness in the voice, you may have some pressure upon swallowing, you have pain in the lymph nodes, and often there's a lump that's felt right in the neck. I had a patient recently who had been diagnosed with stage 1 thyroid cancer. This is after years of being in remission of breast cancer, and she was pushed for this thyroidectomy. And usually this is the approach that most people take, is they think, just get the cancer out and we want it gone and we don't want to have to think about cancer ever again. And I completely understand you want to ease your mind and get rid of the tumor. However, you need to look at the side effects of what this surgery can entail. You think about the nerve damage to the larynx that could happen, scarring, and then medication for the rest of your life. So with this patient specifically, when taking on a metabolic approach, we make sure to look at the whole panel of blood work of what is actually going on in her system. So knowing that it was still very early on stages, we actually denied having the surgery, and she felt very confident in controlling her blood work every 3 months, looking at how we can change things around, lower inflammation, support a healthy thyroid stimulating hormone. We know that the higher the levels of TSH, or thyroid stimulating hormone, the more risk for a cancering process to happen. The other thing is having regular ultrasounds. So if there's any budging in the tumor process, we know that you can take action right away. So for this patient specifically, she decided to not do surgery and just to monitor and make sure that it is not progressing. The other thing that people don't realize is that when you're put on Synthroid after a thyroidectomy, that is just T4, and your body needs to convert this T4 into the active thyroid hormone T3. So you need a healthy gut, a healthy liver, and also healthy adrenal glands. So for example, if you are pumping out cortisol from your adrenals because you're super stressed, go all the time, it's very hard for your body to convert that Synthroid T4 into the activated T3 hormone. If you're looking for support in taking a metabolic approach to cancer, having regular metabolic lab work done, I would love to help you in this process. You can go to drlori.ca to understand the many options and how I can help you. So if I was Sophia's naturopathic doctor and managing her case, I would make sure that we redo lab work every month until her TSH is under 1. And not just looking at her TSH level, we want to look at free T3, free T4, reverse T3, and as well as thyroid antibodies. All of those levels play a huge role in what her thyroid stimulating hormone will look like. The other testing that I'd like to see at least every quarter to twice a year is having her adrenals looked at. So knowing that she's a very busy actress and has a family, lots on the go, you want to make sure to have her cortisol in check. So not just producing enough cortisol, but making sure that it's metabolized properly. So like I said, if the Synthroid and the medication is not being activated because of a high cortisol level, then there's no way that we can have the activated T3 doing its job. So some of the symptoms of having lower T3 and the activated thyroid hormone is feeling cold all the time, easier weight gain, just having no energy, brain fog, and you just feel completely lethargic and possibly even gut issues, so more constipation. So all of that is pointing towards an underlying metabolic issue, which really needs to be addressed. In my next video, I want to talk all about Bob Marley and his experience with melanoma. He passed away way too soon, and I want to do a complete holistic review on the care that he had and what maybe he could have done differently.